Hey guys, Dr. Ko here from Reset Ketamine, and I just wanted to take a moment with you to share some information about ketamine. In particular, the 7 types of people who should not receive ketamine. The first one are patients who have uncontrolled hypertension. So as you may know already, ketamine will actually increase patients' blood pressure and heart rate during the infusion. So if the blood pressure is uncontrolled, it might make the blood pressure go to a higher level that can be dangerous to the heart and the brain. The second type of patient who shouldn't receive ketamine are those who have a history of heart attacks and coronary artery disease. Again, ketamine is a drug that will stimulate the heart. And so it'll raise the blood pressure, it'll raise the heart rate, it'll make it work. And so if someone has had a history of a heart attack, and there is definitely an increased risk of stress to the heart during the ketamine treatment. The third type of patient who shouldn't receive ketamine are those who have uncontrolled thyroid disease. And that's either severe hyperthyroidism or severe low thyroid, hypothyroidism. Ketamine can interfere with the thyroid, and you want to get the thyroid under control before you begin any ketamine treatments. Another category of patients are those who have an active substance use disorder. Although there are some studies showing that ketamine can be used for substance use disorder, we think it's actually better for the patient to be detoxed and weaned from their drug that they're actively taking, especially if it's in an outpatient clinic like the one we have here at Reset Ketamine. Now, if it's an inpatient hospitalization, that's a different story. And the fifth group of patients who shouldn't receive ketamine are those who are in the manic phase of bipolar disorder. So if someone has pressured speech, racing thoughts, and is really manic, don't get ketamine. That is not a good time. However, if someone is in that lower portion of the bipolar, where they're in that depressive phase, that is a time where ketamine can actually be effective. The sixth type of patient are those who have schizophrenia, or if they have active delusions or hallucinations. Ketamine is a dissociative anesthetic. It's also a psychedelic. It can have patients trigger a psychotic episode. It's also known as a schizophrenomimetic, meaning it mimics the symptoms of schizophrenia. So if someone has a history of schizophrenia, or even a family history of schizophrenia, you want to be cautious in receiving ketamine in that group of patients. All right, and the last group of patients who should not receive ketamine are those who have previously tried ketamine and they've had a bad reaction. If you've had ketamine before and there's been a terrible reaction, it may be wise to stay away from ketamine treatments because it could trigger those same exact feelings that the previous ketamine experience had, and we don't want to trigger that. So those are the 7 types of patients who should not receive ketamine. It's not for everyone. It's a great drug, but patients really need to be screened carefully to make sure that they're an ideal candidate. So let me know what you think about this. Leave me any questions, comments below, and I'd be happy to answer them. Catch you next time.